Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, how are you doing? Today I want to talk to you about a medication called CIRULAN. It's also known as Metoclopramide. In this video, I'll tell you everything you need to know about how and when to use it. So what is CIRULAN? CIRULAN helps with nausea, vomiting, and other stomach and intestinal problems. Doctors usually give it to people who have trouble digesting food or who have migraines. And how does it work? Metoclopramide is what makes CIRULAN work. It helps food move through your stomach and intestines faster. It also stops some signals in the brain that make you feel nauseous and vomit. Let's talk about how much to take and how to take. You usually start with 10 milligrams, 3 or 4 times a day, 30 minutes before meals and before bed. But remember, it's super important to follow your doctor's instructions. You also have to know about the possible side effects. Some people might feel sleepy, dizzy, or even have higher blood pressure. If you feel anything weird, call your doctor right away. Lastly, there are some things to be careful about. Don't use CIRULAN if you've had muscles moving on their own or if you have epilepsy. And tell your doctor about any other medicines you're taking. So CIRULAN can be really helpful for stomach problems and nausea, but it's important to use it the right way and always talk to your doctor. Thanks for watching. Take care.
If you've made it this far, let us know in the comments why you're using this medicine.